Today's episode is brought to you by Microsoft Dragon Copilot, your AI assistant for clinical workflow. Learn how Dragon Copilot can transform the way you work. Stick around after the episode or visit aka.ms/knock-knock-hi. Again, that's aka.ms/knock-knock-hi.
Knock, knock, hi.
Hello, everybody. Welcome to Knock Knock Hi with me, your host, Dr. Glauc Talk.
And me, your host, Lady Glauc Talk.
We're co-hosts.
Hey!
I started doing the Knock Knock I intro.
Yeah.
Sorry, I didn't think about it. We are the Glauc Talk, and we're doing an episode of Glauc Talk today.
That's right.
And I've got a couple things right off the bat for you. One is circumcision was in the news.
Oh, I didn't see this.
That's always a fun thing when circumcision's in the news. By the way, that is one of those topics that, like, you'll hear some very vocal opponents of.
Uh-huh.
When I went to speak at the American Academy of Pediatrics a month or so ago, they said every year they always have like a group of people that protest the act of circumcision.
Like outside of
Yeah,
the
like
conference.
yeah.
Yeah.
It's like a pretty common one.
Mhm.
And it got me thinking, like, and more recently in the news, it was circumcision was the newest thing that was like somehow connected to autism.
Are you serious?
Yeah, did you hear about this?
No, I mean, I heard about the Tylenol thing, obviously,
Well,
but circumcision too?
I don't honest. So yeah, it was I saw a clip from RFK, and he was basically because when kids are circumcised, then they are given Tylenol,
I see.
and that's how the connection was made. But then, in describing it, made it sound like circumcision is kind of like a factor here. Like,
Mm-hmm.
it didn't outright say like don't get your kids circumcised, but like, it was just a weird connection. And man, so much of this is just like, honestly, if people really like stop talking about correlation as causation, like that,
yes.
it would, and if people just understood that.
That's what I was going to
Just
say. Like,
in general.
maybe we just need to start there in educating the public. Let's talk about that issue.
Every high school needs a biostats class.
Yes.
But the only teaching point for the whole semester
Correlation
is what correlation
not
means.
causation.
And what causation means.
Yes.
That's it. It's going to be very repetitive, but it's going to get into
It'll
everyone's
get it.
long-term memory.
That's right.
We can choose like one or like two or three topics.
Mm-hmm.
It's the class. This is your correlation versus causation class for 3 months.
Mm-hmm.
We're going to show you examples.
Did you know that
Correlation is not causation.
ice cream causes murder? Did you know that?
No, I didn't.
Yeah, because see, like in the month of July,
Yeah.
there's a lot of ice cream sales
Okay.
and there's a lot of murder.
Oh yeah. I heard about this.
Yeah.
I heard. It was an article.
Yeah.
In
the Journal of Complete Nonsense.
So it's,
No, in the Journal of Correlation Does Not Equal Causation.
no, and it's and like now that I think about it, so we can in this fictional class, we could also just do different types of biases
Mm-hmm. Yeah.
that come up, like survivorship bias.
Mm-hmm.
What's the other bias? There's
I'm not sure where your head is going, but
like the different bias you'll see in,
for like
in medical studies.
Mm.
And
I know about like thinking biases. I don't know about medical studies.
confirmation bias. That's what I'm trying to think.
Okay, yeah,
Like confirmation bias,
exactly.
like anchoring bias, and like all these things. So like all these different types of biases
Mhm.
would be an addition to the correlation.
I
versus
think that
causation.
is an excellent class, and I'm not even kidding. Those,
Did you? I
biases and correlation causation.
I took stats in high school.
Would be so
Did you take
valuable.
stats?
Okay, listen. I don't even know if my school offered stats.
You took wrangling.
Right. And I did not actually.
Did they have a
but,
rodeo class?
They had FFA.
Oh, okay.
I mean, that wasn't a class, but it was popular.
That was just home.
I mean, well, it's it's a national
I
organization or
know.
something.
But like
but
you did a lot of rearing of things at home.
I did.
You
I
reared
reared.
things. Extracurricular.
Yeah, no, my
extracurricular
high
rearing.
school was not
No
large enough
stats.
to offer
Okay,
a class like that.
gotcha. All right. Well, that's the first thing just wanted to bring up. Is the the circumcision thing is kind of wild. It's not like a huge deal, but it's just kind of a weird
Yeah.
thing that made
Like,
the
how
news.
did we get here?
Also, like kind of like we never dealt with that as parents because penises were not
Oh,
involved.
right. Because we had two girls.
Yeah.
And yes,
Like it's
we didn't have to make that decision.
yeah. So I don't really have much to say about as someone who has been circumcised.
Yeah.
Just to let
I guess
everyone know.
that's, your qualification.
Didn't really affect me one way or the other. But I know there's some like health benefits of circumcision.
Yeah. What would you have decided or wanted to do?
I mean,
if
all
we'd had
I
a
know is
son?
what I know, and I probably would have gone for it.
Yeah.
I don't know. I would have done my research.
Yeah. I would have
Listen to my
deferred to you
doctors.
both as a man. I didn't like how that sounded. I would have deferred to you as
a penis, as
the
someone
one
with
of
a penis.
us who has a penis, and also as a medical professional, given that this is a medical topic.
And as an ophthalmologist, I would have deferred to someone who knows more about penises.
Well, right.
Than
So
me.
you're going to be able to find better information than I can find, as you have access to things.
You can Google penises just as easy as I could. Actually, don't Google penises.
No, exactly. That's what I'm saying. Like you would have the
Yeah.
medical, like you could go on Up to Date or something. You know.
True. All right. Let's change topics now.
Okay, please do.
So there was a story that I saw on Forbes all about physician side gigs.
Yeah, that's a popular topic.
It's like steadily growing in popularity. So there's a 2025 Medscape survey. 4 in 10 physicians now have a side gig.
Wow.
And nearly 75% report equal or greater fulfillment compared with clinical medicine. So, full disclosure, I have a side gig.
Yeah, I don't know if you knew.
I'm doing it right now. And I will be honest, sometimes I want to quit medicine and just do my side gig.
Mm-hmm.
Sometimes I want to quit my side gig and just do medicine. So guess what? You just do both. That's what it's like. It always makes me uneasy when I hear about physicians who like went through medical training and everything and became a doctor and think like, oh, I'm starting to make money doing this thing on social media.
Yeah.
I'm going to quit medicine and just do this thing. I don't know. It's like very volatile.
It is. That's, I think, maybe what people don't necessarily think about up front. Like,
right.
You might achieve an initial level of success, but then maintaining the success is a different skill set.
Let me give you an example. Okay. Just to maybe convince people like, now it's one thing if you just don't love practicing medicine anymore. Like that's, some people have to leave for their own mental health, you only have one life to live and maybe you don't want to spend it practicing medicine. And that's totally different. That's a different thing. But this is for like the people who have like a decent side gig. Maybe they're making as much or more doing that than they are as a physician. I'm going to give you an example of why you got to like really think about it before you give up a relatively stable career as a physician.
Right.
So, I'm going to go October 2023 to October 2024. I made X amount of money on YouTube.
Yes.
October 2024 to October 2025, I made
like
about
X divided by 10.
I made about 30% of what I was making. Okay. Same content, same relative frequency. You know what changed, folks? YouTube reclassified what a short is from 60 seconds to 3 minutes.
Yeah, up to 3 minutes is now a short. And shorts are compensated
Yeah.
at a different level than
Right. So
what are they called? Longs?
long form. long form. So long form content, per million views, you get about $3,000 to $5,000. Short form content, this is on YouTube, you make about $32 per million views. So that gives you that tells you just where all the money is in YouTube. It's in long form video.
Right.
And so
For now,
all of a sudden, I was like making really good money posting my 2-minute videos as long form content on YouTube. Then they reclassified what a short was, and it makes sense from a business standpoint for YouTube because short form content was blowing up.
Yeah.
Everybody had all of this short form
because
content
of TikTok.
because of TikTok, right? And so they reclassified it. Smart move on their end. Bad for short form creators like me, because now all my videos were suddenly classified as a short, and it really cut all the income. The point is not to feel sorry for me. Like,
No.
it's fine. It's fine. But the point is, like, when you have a side gig like social media ad revenue, you don't control any of that.
Right.
You're at the whim of the platform and how they decide you get paid. Regardless of how much work you do, you have no control over that. And so, as opposed to medicine, now you can say, well, medicine, changes too. And sure, it does. Like hospitals get bought out, reimbursement is affected, but there's no question that something like medicine is more of a stable career than like content creation or podcasting. So, so that's just my 2 cents about that as a side gig.
Side gig. There's lots of side gigs, though.
Can I actually, I want this will be like a little game.
Okay.
All right. I'm going to give you a potential physician side gig, and you rate it on 1 to 10 on how awful it sounds.
Okay. And I just get to decide what defines awful.
Yeah.
Okay.
Yeah. Just like your gut reaction. Like, does that sound fun to you?
To me personally.
To you personally. All right. Here we go. Telemedicine.
To me personally, no.
So
to a physician, perhaps.
We'll say 1 is terrible, 10 is super fun.
Okay.
Telemedicine.
Do I need to take the perspective of someone in medicine, though?
Sure. I mean, you're adding your own personal thoughts to it.
Yeah, because for someone practicing medicine, I could see telemedicine as being like at least a 5, if not a little more, because like you can do it from anywhere, so that's nice.
Remote consultations for patients, offering a flexible and convenient way to see more patients. I would give it a 1.
Oh, well, for ophthalmology, it's not a good fit.
Pandemic era teleophthalmology made me want to claw my own eyes out. It takes a lot.
That's saying something.
A lot for an ophthalmologist to say that. But I would say I think it's probably much higher for other people that are more open to
where
doing
it does
telemedicine.
make sense to do.
Right.
It's
certain specialties
nice
makes more sense. All right. Expert witness work.
Ooh.
So there's a malpractice case, and you get called, I've received these calls from law firms. They're like, hey, would you be willing to review this case? I haven't done it.
And they pay you to do that?
Yep. You have like a pretty sizable fee. I think you can probably charge upward of like $1,000 an hour for stuff like that. So that is a very
lucrative.
It can be a very lucrative thing. I mean, not that those types of things come up all the time, but if you get a reputation for being a doctor who does expert witness work, you probably, just like anything, like you get a reputation, like you get more work.
Right.
How do you feel about that?
I think that could be, it could be like a 6 or a 7 because it's like interesting and it's not something that you get to see every day, and people like true crime and what have you. But it could also be really depressing.
Yeah, I would give that a 2.
Yeah.
For me personally.
Yeah, I think I would fall on that.
Sounds stressful, and I like people's lives and careers are at stake.
Right.
And
you have to hear all sorts of awful things.
And that's not my mindset as an ophthalmologist. I chose not to pursue a career that involves
people's
death
lives
and and horrible things. And so it's, I'm no interested in expert witness work, but I know people that do it. Medical consulting, I've done some of this where you advise startups, companies like device companies, pharmaceutical companies. They want a physician perspective on different things.
Mm-hmm. I would put that pretty high, probably like 7 or 8.
Yeah, I'd give it's like a 5 for me.
Yeah.
It's fine. Yeah.
Mm-hmm. It's
I've
kind of like teaching.
Yeah, I haven't done a lot of it, but I've kind of dabbled in it, and yeah, a little bit. It's mostly just like Zoom calls where they have like one specific question, like, "What do you think about this?" And then everybody chimes in with stuff. I don't know.
Yeah.
It's okay. Zoom.
Well, but
Yep.
sometimes, just like with telemedicine, you're looking for something that you can just do from home, and you don't want to have to drive into somewhere every day.
Here's another side gig: chart or utilization review.
-1,000.
-1 billion.
Yeah.
Absolutely. Those are your medical directors. That's what they call them.
Yeah.
United Healthcare.
Yeah.
All the insurance companies call them medical directors because they find physicians who are looking for extra work, and they'll pay them to deny claims, basically.
Yeah.
So don't do that, folks. There's I'm giving you all these options
Yeah,
for side
yeah.
gigs. There's so many other things that you can do.
Yeah.
How about a couple more? There's locum tenens. You know what that is?
Yeah. Yeah. You go around and you take temporary.
Yeah, you fill in for physicians on a temporary basis, or there's someone's just in dire need for some doctor to come fill in for a while,
Mm-hmm.
and you get paid like triple your normal rate, but you have to go, live in a new place.
Right. See, this to me feels a little bit like the medical witness, expert witness thing, in that I can see how for some people this would be really desirable.
Yeah.
If you want to be moving around a lot and seeing different places and meeting different people and, maybe seeing a different kind of population and your patients, right? That could be really appealing. But then for other people, like us having kids, it'd be very difficult.
Yeah. As a single, unattached person,
Mm-hmm.
I would give that an 8 or 9.
Yeah. You get really good pay.
Yeah,
and you get to just kind of
explore.
go around and
As a married person with kids,
yeah, it's not.
It's a 0.
Can't do it. Yeah,
it's not possible.
Not an option.
That's good. That's good. What do you think about? But which one would you choose?
Of those, I see medical writing on this list. I would choose that.
Yeah, that's kind of content creation, medical writing.
Well, and writing articles for health websites and.
Yeah, how much can you possibly get paid for that kind of stuff, though?
Yeah, probably not a lot.
It's as a side gig,
yeah,
for the amount of work you have to put into writing, maybe.
Right.
I guess what's the website where people have the writing thing? People have their own blog. No, their own blog of things. Substack, that's it. So I guess you could have your own Substack and make some subscription dollars doing that.
But then it says create content for medical journals. That might be at least a little better pay.
Yeah. Maybe we should try to focus on making it to where physicians don't feel like they need to have side gigs to feel fulfilled. I'm not even sure they're doing it honestly to what I'm wondering how much of it is needing to make extra money or looking for something that fulfills you.
Right. What's the motivation behind the side gigs?
Yeah.
Increasing.
Because I think we would be surprised how much of it is actually I feel like I'm in a rut. Mm-hmm. I feel like my job is not fulfilling. I need to find something to do with this degree in medicine that makes that brings joy to my life. If it just so happens to make me extra money, great. So I don't know.
It might also be, though, that they just like doing that other thing. And it's just another part of their, personhood that they would like to explore, with you and creativity. You didn't really set out to start a side gig.
True.
You just were having fun.
All right, let's take a break. Come back with a medical topic. Hey, Kristin.
Yeah.
I just have to talk more about Demodex blepharitis.
I'm sure you do.
It's just, I just love all things eyeballs, but not the mites this time though.
Okay. I
I'm gonna give you a
appreciate
break.
that.
I'm gonna give you a
Thank
break.
you.
We're talking about collarettes.
Okay, the crusties.
Crusties.
Yeah.
Yeah, it's kind of a cute name for Demodex blepharitis
I guess.
finding on
Sure.
exam. The thing is, I want to educate patients that you can't always see these things yourself.
So, and you can't feel them?
No, because they're so small, so you have to come in to see the eye doctor, either an optometrist or an ophthalmologist. We use a microscope. We can see all the collarettes on there.
Okay.
And because it's hard for people to connect this sign on your exam with all the symptoms.
Because they can't even see it or feel it.
Right, the itchiness, the redness, the irritation that could be due to Demodex blepharitis. It's a great time now to make an appointment with your eye doctor before the end of the year and deductibles reset.
Yes.
You got to
Very important.
To see more pictures of crusties and eyelids with Demodex blepharitis, visit miteslovelids.com. Again, that's miteslovelids.com to learn more. This ad is brought to you by Tarsus Pharmaceuticals. All right. Now's the time. Now's the time to learn. All right. We got our first aid. USMLE Step 1, 2025.
Okay.
All right. Let's pick it. 32 to 706.
Okay.
Pick a page. Any page.
497.
400. Okay. That one is okay. You've never done that one before. That was a problem for a while.
I know. Well, it's still very hard. I have to go against my initial instinct.
So hard. There's so few numbers.
I just keep picking the same ones and forgetting that I've picked them already.
497. So we got gout drugs.
Ooh.
Maybe for this one, it's prudent for me to talk about gout.
Okay.
And then we can talk about the gout drugs.
I think that makes sense.
So while I'm looking up where in this book gout is, why don't you tell people what you know about gout?
Gout. I think there was it a king or a president, maybe, that had gout? I think of feet.
Yeah.
Okay. Was it the president? It was a president, not somebody's.
Are you thinking of the guy that couldn't fit in a bathtub?
Yes, I thought it was that
Howard
he got
Taft?
stuck in a bathtub, but he just couldn't fit.
I don't know if that was a legend.
Who knows if that's actually
really
true?
All right. Let's talk about gout, and then we'll get to gout drugs.
Wait, is gout related to goiter? Because that's the other
No.
thing that popped in my mind was the Seinfeld. Where the lady's got a
The lady had
goiter
a
on her
giant
neck.
goiter and was talking about her love affair with Mahatma Gandhi. He rubbed oil all over my body. All right, gout.
Okay.
Gout is an acute. What part of the body would you say gout?
Well, I told you I
affects? The
thought
foot?
of feet.
Yeah. Okay. It's a joint disease.
Oh, it is?
It's a joint disease. Yeah, it just happens. So acute. It's an acute inflammatory monoarthritis.
Oh.
Which means that monoarthritis means it typically just affects one joint.
Yeah.
It's caused by a precipitation of urate crystals in your joints. Can you imagine how painful that would be?
That sucks.
Crystals
Yeah.
in your joints.
It'd be like gritty in there.
Now, good news for you.
Okay.
Risk factors: male sex,
Okay. That's not me.
hypertension,
Don't have it.
obesity.
Nope.
Fear of spiders.
I do have that. But
Diabetes?
I think you're lying. I don't have diabetes.
Dyslipidemia.
I don't think I have that.
That's like cholesterol.
Oh.
Issues.
No, I don't have that.
Alcohol use.
Well, I do drink sometimes.
Yeah. I think you're pretty
I have,
low.
a glass of
I
wine.
would say you're pretty low risk for gout. Strongest risk factor, though, is you have a history of hyperuricemia.
What is that?
I'm so glad you asked.
Oh.
So it's too much uric acid in your blood. So hyper, high.
Too much. Yeah.
Uric acid. Emia in your blood.
Okay. What does uric acid do? What is it?
So uric acid is it's a
This is what you don't like.
it's like it's just
uric acid.
It's uric acid. It's like an acid.
That's uric.
It's uric. And it's got a chemical structure. And
When I think of
it
uric
has something to do
or
with
urea, I think of
it's
the
something
kidneys and like
you're right.
pee.
I think it's something kidney related. Let's see if this will tell us as we go here. So, it's caused by under excretion of uric acid. So yes, like it's something uric, urea. It's related,
Mhm.
and in the kidneys. And normally you get rid of it,
Mhm.
but if you can't excrete it,
Mhm. It
um,
builds up.
it builds up. And so 90% of patients that have gout, it's because they can't excrete uric acid.
Mhm.
It's mostly idiopathic,
Hmm.
which means like
They don't know why it
they
happens.
don't know why it happens. They just get it. But it's made worse or increases the risk if you have renal failure. So
Okay.
yeah.
So yeah,
it's a kidney
kidneys are
thing.
involved.
It can also be exacerbated by certain medications,
Hmm.
like certain diuretics,
Okay,
because
sure.
those act on the
Mhm.
kidney, and
Diuretic.
they will affect like different whether or not different molecules are absorbed or excreted.
Mhm.
Usually like electrolytes.
Okay.
So like a loop diuretic, which is furosemide, Lasix,
Mhm.
which is something I'm always making jokes about.
Mhm.
That can cause you to lose a bunch of potassium because of the
Okay.
way it works on the nephron.
Mhm.
And so you have to sometimes supplement with potassium
Mm.
if you're on high doses of that medication. Um, so that's under excretion. That's most of patients.
Okay.
Or it can be just overproduction of uric acid. Your body makes
Yeah.
more uric acid than it's supposed to, which is about 10% of patients.
Okay.
So there's some very more rare disorders like Lesch-Nyhan syndrome, which the only reason I remember that is because it was a disease in a book that I read in high school where it's like it causes auto phagia, like you bite yourself.
Oh.
And it's like it affects your neurologic system, and you like bite.
Like you bite your
Yeah.
mouth or whatever,
you
your
bite,
lips and stuff.
exactly.
Or you
Or your
feel
tongue.
compelled to bite other places.
I-
Is it more of like
I
a
think it's
physical,
just more
mechanical?
on your mouth.
Yeah. Okay.
Yeah. And also, if you have increased cell turnover, that's when you see it a lot too, which is like tumor lysis syndrome. So if you're like getting treatment for cancer,
Mhm.
and you have a lot of cells that are dying,
Mhm.
it can release a lot of uric acid,
Mhm.
and maybe you get some gout going on. So these crystals, these uric acid crystals, they're needle shaped.
Ugh.
It's like needles in your joints.
Yeah, it probably feels like that too.
And you'll be interested in this. They're negatively birefringent under polarized light. You like that?
I was wondering.
Yeah, I know you were. So under parallel light, yellow. And you remember that because parallel has two L's, yellow has two L's.
This is what doctors learn.
This is what we do. And they're blue under perpendicular light. And the way you remember that is because it's the other one. The other one is the other one. That you have no idea how many.
I 100% believe you.
How many mnemonics are like
yes.
yellow under parallel light? The other one is the other one.
Mm-hmm.
Blue is under perpendicular light.
Yep. So, you go into your career and you're like, is this the yellow or the other one?
All right. So here are the symptoms. We've talked about like what causes it,
Okay.
right? To your satisfaction.
Sure.
This is the pathophysiology. No burning questions.
I mean, my questions were about
like what is
the
uric
yellow
acid?
and the blue and the light. Like, why are you shining light? What's going on?
That's just a way to diagnose it. So
Okay.
you get a sample, you pull like a little, aspirate some fluid from the joint, and then you can, if you suspect it's gout, then you can send it to the lab and they'll do that polarized light thing and it'll show up.
Okay. And which one is?
I know
so
you're gonna ask like, why does it look yellow? Why?
Well, they
in
probably
different light?
dye.
It's optics. It's like
they don't dye it. It's just.
I don't know. I don't know what they do with it.
Okay. So are they looking for yellow or blue? What's good?
It's just the way it doesn't matter. It's just like that's what it looks like under that color light.
Oh, so it's not like normal is one way, and if you have gout, it goes the other way.
No.
Okay.
It's just under polarized light.
That's what it
that
looks like.
color.
Gotcha.
All right. So symptoms of gout. So the joint is swollen, red, and painful. The classic manifestation is a painful big toe of the MTP joint, metatarsal phalangeal joint.
Oh, phalange.
MTP, I think that's what it is. So it's basically just a big toe.
Yeah.
They call that podagra.
Podagra. Okay.
Podagra.
Pod.
That's a great name for like a
toe.
dragon.
Yeah.
In like Game of Thrones
I
or
can
something.
see that. I bet dragons have big toes.
And it's like super classic, like nothing, the classic teaching is like the patient will, if you like put a sheet over the toe, the patient will scream in pain. It's that painful.
Oh, wow.
Like nothing touching the toe.
Mhm.
They can't move the toe because these needle-like crystals are just scraping up everything inside the joint.
So that begs the question, if they suspect gout,
Yeah.
is that sheet thing a thing they do on purpose?
No.
Let's see if this guy has gout, and then he screams in pain.
It's more like
It's just
something.
like if it happened,
it's more like
you would suspect.
Right. It's more like a historical thing.
Okay.
Yeah.
Oh, if they come in and
they say I
like,
can't even have any, like even just the sheet on my bed hurt my toe, and so I couldn't sleep. An acute attack, because it usually happens acutely, it typically occurs after a large meal with foods that are rich in purines. So purines are like red meat, seafood, like protein-rich food. Has like purines, which I guess are broken down into uric acid. And so if you're prone to gout, you probably want to avoid all those purine-rich foods, like Purina.
Puppy chow.
Dehydration. We talk about diuresis. These are all things, increased alcohol consumption.
Because it's a diuretic.
Exactly. Yeah. So you get increase in blood lactate from metabolism that increases the resorption of uric acid, which leads to hyperuricemia. Okay. That's gout. So let's take a break and we'll come back and talk treatment.
Ooh.
So far in a scale from 1 to 10, where would you rate gout as something you would want to have?
0.
Okay. It's pretty low.
Yeah. Lower than the scale goes.
I would not like to have gout. Gout would be very annoying to have.
It sounds extremely painful.
It's probably, I guess, how should we do the scale? Be like 1 is like, not a big deal. 1's like allergies. And 10 is glioblastoma.
So like how bad would it
sorry.
be?
Let me reword that.
Okay.
And we'll keep doing that for any diseases that come up in our discussions.
Okay.
I would give gout. Gout's like a 6 for me.
Only a 6?
Because there's a lot. Because it's not fatal.
Well, fair.
So it's like something that can be treated. But it's painful, and it'll probably knock you down for a few days.
Okay, so it's not something that you have to just live with. That's what I was envisioning, like chronic pain from gout.
You can treat it.
Okay.
Yeah.
Okay.
Keep the uric acid levels low.
Yeah. Then I would say I would agree, like a 6.
All right, let's talk about treatment here. So the classic drug is called Allopurinol. That's your
Purine.
Yep, exactly. So it's a competitive inhibitor of an enzyme called xanthine oxidase, which basically decreases the amount of uric acid that purines are.
Okay, now we're getting into double negatives. So
purines through several enzyme reactions are broken down into uric acid. So what allopurinol does is it just blocks one of those enzymes.
Okay.
That
breaks
break
down
purines into uric acid. It's called xanthine oxidase is the enzyme that it knocks it out. And so that's like that. Honestly, that's the only one I've ever seen patients on, but there's other ones. There's like something called probenecid. I've heard of that one. That inhibits the reabsorption of uric acid. So it doesn't block the production of uric acid, but it prevents the kidneys from absorbing it into the bloodstream. So it'll just help you pee out the uric acid, basically. Febuxostat.
Ooh.
How about that one?
That's a tongue twister.
Febuxostat, which also inhibits xanthine oxidase.
Okay.
Here's what you think. You think febuxostat makes xanthine oxidase static.
That does not help.
That's the mnemonic. That's the mnemonic.
That's more complicated than just learning the word.
How about there? Here's what they have the mnemonic for allopurinol. All painful flares are preventable. Allopurinol.
What?
I think.
How is that a mnemonic? These are a real stretch.
So anyway, so those were the preventative drugs. So let's say you have a bout of gout and you want to prevent another one from happening down the road. You put them on allopurinol.
Okay.
Because it prevents the production of uric acid.
Okay.
But if you have an active gout situation, like your toe is blown up, it's red, painful, NSAIDs.
That's it?
NSAIDs, non-steroidal anti-inflammatories, ibuprofen, probably high doses of it too.
Yeah.
So
you get that. So you get it to go down, and then you put them on what's it called?
Yeah, exactly. So the active gout drugs are NSAIDs, steroids. You can do steroids, oral steroids. Sometimes you can even inject it into the joint. And
see, that sounds
horrible.
If a sheet hurts.
Yeah. Oh my God. That's like you got to sedate the person to be able to do that. Also, and that's a small joint in the foot, in the toe. Also, colchicine. Colchicine, is that one of those organelles? I remember something like there's some organelle that's like sounds like colchicine. Maybe it is colchicine. I don't know.
None of this is ringing a bell for me.
Okay, I'm gonna have to look that up. So colchicine binds and stabilizes tubulin. Fun word, tubulin.
That is a fun word.
To inhibit microtubule polymerization. Blah blah blah. I don't know what it's like.
You're getting into the blah 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 stage of explaining.
Colchicine is some kind of anti-inflammatory, it looks like.
Okay.
So
treatment is basically anti-inflammatories.
Yeah, exactly. Just you're trying different ways to induce, to prevent inflammation in the joint. So anyway, that's gout.
Would an antihistamine? No, that's different, right?
Yeah,
Antihistamine.
No antihistamine.
I was thinking like Benadryl, when you're allergic to things.
Definitely not.
Nope, that's different.
All
Different thing.
Gout. So
The
now
more you know.
whenever because I'm a male and I have high
high cholesterol.
And I occasionally will drink alcohol. No, I don't have hypertension.
Family history?
Nope.
Okay, good.
But, you never know.
Never know.
I also don't eat a whole lot of red meat.
No, that's true.
So I think I'm fairly low risk.
Okay.
But you know how to treat me.
Now I do. I'll go get you some
is.
ibuprofen if you scream when
And
the
don't
sheet
make the bed.
touches
Don't
you.
put the freaking sheet on me.
That's
You'll have to sleep without
No,
any
you will.
blankets.
You will.
All right.
Doesn't mean I have to.
All right. That's our Glauc Talk for today, folks. Let us know if you have any thoughts about gout. Have you had gout? Does someone you know have gout? Send us an email at knockknockhi@human-content.com. Actually, just if you have a funny story about gout. I bet there's some good stories about gout.
Yeah, we need more funny stories.
Gout seems like
it could be funny in retrospect.
Maybe, yeah, right.
You
in
need
hindsight.
enough time to have passed.
Exactly, as most things are. Time,
Tragedy
comedy,
plus
what is
time
it? Yeah,
equals
that's
comedy.
what I'm trying to get to. Yeah, there you go. Email us, knockknockhi@human-content.com. Thanks to all the great listeners leaving feedback and reviews. If you subscribe and comment on your favorite podcasting app or on YouTube and give me a shout out, like at Caroliden on YouTube. It's so hard, these YouTube names. Said, thank you for taking time to inform us. Oh, that's so nice. We try to do a little education.
Hopefully there is some accurate education in there somewhere.
It's very accurate. I'm taking it from an esteemed source. All right, so this is accurate information, but sometimes we might make mistakes, so we get off topic.
Because then I ask questions that are not in the book.
Can't ask questions that aren't in the book. What are you doing? Full video episodes are up every week on our YouTube channel at Glauc and Fleckens. We also have lots of perks over on Patreon. Go check it out. Early ad-free episode access, interactive Q&A live stream events, much more. Patreon.com/Glauc and Fleckens. Should we shout out the Jonathans?
Let's do.
Patrick, Lucia C, Edward K, Marion W, Mr. Granddaddy, Caitlin C, Brianna L, MP Cole, Mary H, Keith G, Parker, Muhammad L, David H, Kaylee A, Gabe, Gary M, Eric B, Marlene S, Scott M, Kelsey M, Dr. Hoover, Sean M, Ryan N, Jess K, Hawkeye MD, Spellby Salt,
Shani D.
Brandon, our Patreon roulette, random shout out to one of the emergency medicine tier. Raymond S. Thank you, Raymond, for being a patron, and thank you all for listening. We're your hosts, Will and Krista Flannery, also known as the Glauc Talk. Our executive producers are Will Flannery, Krista Flannery, Aaron Cordy, Rob Goldman, and Shanti Brooke. Our editor and engineer, Stacey Portizo. Our music is by Omer Ben Zvi. To learn about Knock Knock High's program disclaimer and ethics policy, submission verification, and licensing terms of HIPAA release terms. I said that very clearly.
You did. Good job.
You can go to glaucomplaga.com or reach out to us, knockknockhigh@human-content.com with any questions, concerns, or fun medical puns. Knock Knock High is a human content production.
Goodbye.
Hey, Kristen.
Yeah.
Let me tell you something.
Okay.
You know what physicians are always telling me about?
How gross eyeballs are?
No, actually, how wonderful ophthalmology is as a specialty,
okay.
but also how sick of documenting they are.
Oh, yes. That
Because
has gotten out of hand.
It's gotten just too much to document now,
That's right.
which is why I really love what Microsoft Dragon Copilot is doing.
Yes.
Using AI assistant to just help the physician.
Yeah, take some tasks off your plate. Save
Completing
your
all.
time.
Yeah, and there's new levels of customization available using Microsoft Dragon Copilot. You can capture multi-party conversations. You can convert conversations into specialty-specific notes. Get notes delivered to the EHR for review and editing. It's all right there for you.
Love it.
It's great and helps to automate tasks, surfacing information. Just lets you focus on the patient-physician relationship.
Yeah.
It's what it's all about. So to learn more about Microsoft Dragon Copilot, visit aka.ms/knockknockhigh. Again, that's aka.ms/knockknockhigh. Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Help you subscribe, leave a comment below. Let us know what you think.